Bismillahirrahmanirrahim. Nahmadu nusalli ala Rasulil Kareem. Assalamu alaikum. There is a lot of talks today. Dr. Junaid Sarfraz made my job easy. He discussed medical professionalism or medical ethics in Islamic perspective. And when I talked to Dr. Hamdani that I want to give a talk on medical leadership, he said, give a talk, medical leadership in Islamic perspective, leadership in healthcare in Islamic perspective. I am not a religious scholar. It is a very difficult talk. In the literature, there is no literature available over it. I have not seen any of the article on Islamic perspective of medical leadership, but this is the hot topic nowadays. Medical leadership topic is also scanty, but in the last few years, there is a lot of written on the medical leadership. I will ask you, how many do you feel you are leader in the hall? Only one. Two. Whenever we are said that you are leader, we feel we are not leader, only political leader. Everyone is leader. You have to play your role as a leadership in the health professional, and while you are treating the patient, while you are teaching the student, while you are training your resident, you have to play a leadership role. Now we will go through this presentation. ये इसको रन करें भाई, ये बे नहीं कर रही. There is only 15 minutes, और अगर हम इस presentation के end पे convince हो जाते हैं only 10% के we are medical leaders, तो मैं समझूंगा कि मेरी talk करने का कुछ ना कुछ फायदा जरूर हुआ. किसमें? अच्छा ठीक है. So the aim of this presentation is to discuss the background of medical leadership, what we mean when we say medical leadership, how Islam defines a leader, and what are the leadership qualities in Islamic perspective, contribution of old Islamic leadership in healthcare, how it can influence the healthcare leadership, application of medical leadership skill to daily practice, and how we should develop leadership skill, challenges of medical leadership in the physician. Background, you are poorly or less taught in undergraduate curriculum as well as in the postgraduate curriculum about the leadership, but you have to play or you have to exhibit leadership role when you are past your MBBS and you have to treat in the ward and you have to teach your student and you have to teach the postgraduate trainee. When we become doctors, we become leader, but most of us are not adequately prepared for this. This article also highlighted this. We are not taught about the leadership role. What is leadership? A process of motivating the people to work together collaboratively to accomplish great things. A leader takes the people where they want to go, but a great leader takes the people where they do not necessarily want to go, but where they ought to be. And if your action inspires others to dream more, learn more, become more, then you are leader. What is the definition of leadership in Islam? This is ayat from Surah Anam, and it is he and who has made you successors upon the earth and has raised some of you above the others in degree of rank, that he may try you through what he has given you. Indeed, your Lord is swift in plenty, but indeed he is forgiving and merciful. And one of the hadaya, each of you is a guardian, and each of you will be asked about his subject. This article addresses the Islamic perspective of leadership in management and highlighted that we have to play the role as a leader, and we are answerable to Allah. According to this message of our Holy Prophet, leadership in Islam is not earmarked for small elites. Depending upon situation, each person takes a position with a single wave of support and occupies a locus of leadership. And there is a hadaya, whenever three of you are traveling, you should select one of you as a leader. And further advice is that you should obey your leader. until and unless he is very obviously against the Islamic principles. This is the actual principle of leadership. What is medical leadership? Is relatively a new term. Doctors and the health professionals are frontline workers of healthcare and have a vital role to play in leadership, in the leadership and management. By definition, medical leadership exists of having fully trained physician occupying leadership role relevant to the practice of medicine. Leadership role by physician includes resource management, decision-making, recruitment, medical consultation, as well as implementation, change, and improvement in the hospital and clinical setting. And this article highlighted this aspect of medical leadership. And you are poorly taught about the leadership in postgraduate training, but you have to run your operation theater, your hospital, coordinate with the office, negotiate with the hospital administration, raise the fund for research, managing diverse personnel. These are all leadership qualities. And you have to bridge a gap between clinician and administration. And to be effective practitioner, you have to play a leadership role to achieve maximum output in terms of patient care. In the available resources, it is also a leadership role. And leadership role is formal and informal. Formal, जब कोई dean होता है, VC होता है, medical director होता है. Informal, you are always informal leader to treat your patients. This is a formal leadership role, and this is informal leadership role, while you are acting as mentoring, educating, postgraduate training, research, professional society membership, editorial work for journal, outreach and local community. So you have to play this role, but a gifted professional with excellent leadership skill does not automatically becomes a great leader. Reality is that some find this easy or innate, while most of others struggles and often fail, and we are also maximum people belong to this category. But he or she has to be transformed to be a leader by developing leadership skill, by some teaching, training, and by some workshops. Fortunately, these skills can be developed and refined. What is the expected outcome of this presentation is that at the end of this presentation, if you feel I can play, you can play a leadership role, then I will think that my presentation is fruitful. And you should understand the opportunities to develop further leadership skill as a medical student, resident, attending surgeon, academic position, and what Muslim played as a leader in the Middle Ages in the healthcare system. These are the few slides I will not discuss. Prophet Muhammad launched a hospital in courtyard of Masjid Nabawi and a mobile clinic in the camp during Jang-e-Uhud. And the first ever nursing role in Islamic history was played by Rufada al-Islamiyya. She was the first ever. Her father was physician actually. She learned from him, and she devoted whole of life for the patients. And this is the public health and health promotion in Islam based on these principles. Dr. Zafar talked about dietary and fasting, hygiene, burials, addiction, population, pilgrimage, army camps in the battle, and plague and quarantine in Jang-e-Tabuk, where in the Sham. Islamic perspective of leadership is only addressed in few of the articles. This is the untold story that the Muslim played a very, very critical role in the Middle Ages in the development of medical sciences, and these are the role played by the Muslim scientists in the development of anatomy. But they stopped at 14th century. What happened to the Muslim in the 14th century? They go into hibernation state, and from 15th century till now, they are sleeping. Why? They should stand up. They should feel. They have to play a role in the modern world. Ashaq ibn al-Ruhawi, he was the first man to write a book on medical ethics. He wrote a complete note on one of the hospital in 19th century. Mansoor has written an anatomical book, और मैं कह सकता हूँ कि मंसूर की anatomical book का knowledge यहाँ बैठे हुए majority medical students से ज़्यादा था. He defined cranial nerves. He defined spinal nerves. He defined all of the skeletal system. He defined muscular system. And Al-Zuhrawi, he was the first man to introduce the catgut suture. Surgical encyclopedia was written by him, which ran for the 500 years. And Avicenna, Abu Ali Sina, He was the father of medicine. Canon of medicine was written by him that is taught for 700 years in the West. What qualities are should be present in a medical leader? These are the qualities. The above written are charisma, extroversion, a big ego, that I am a leader should not be. But the written in the lower side, vision, listening, selfness, motivation, emotional intelligence, empathy, adaptability, growth, confidence, reliability, accountability, these should be inculcated in a medical professional. The concept of Islam in leadership is based on 5 things: trust, rightness, the struggle towards the self-development, justice, promise keeping. And the guiding principle for leadership in Islam is trust, responsibility, and accountability. And stages of spiritual development is Iman, Ihsan, Taqwa, and Islam. And the source of Islamic leadership derives from Quran, from Hidayah, from Sirah, from 4 caliphs' tradition. And these are the traits which are present in our Prophet Muhammad, may peace be upon him, and our 4 Khulafai Rashideen. They motivated the people. They affectionate or sympathy to the devotee, conviction, unbiased, swift decision, emphasized with the people, a man of principle, could plan with the long-term goals in mind. These are the healthcare principles in Islam: continuing ilm, honesty, amanat, akhlas, continuing learning, self-assessment, communication, creating culture, establishing clarity, building the culture. I have seen only one article in which it is highlighted that the curriculum of the medical education should be blended with Islamic education. This is from Malaysia. This highlighted how a new curriculum can be devised in the perspective of Islam. A Muslim medical professional should be with positive attitude. They should be dedicated, respect, compassion, empathy, honesty, altruism, responsibility. Okay. These are the qualities which should be present in the leaders: integrity, empathy, optimism. And this is the way how do we promote leadership skill in us: by learning, by teaching oriented abilities, by mentoring, by coaching, by action learning, by networking, by experiential learning. And our teaching should be based on experience, observation, and education. It should be assessed and feedback should be given to develop or to correct our faults. So our framework, medical leadership competency framework, provides us a guidance how we can develop these leadership qualities. This is based on personal qualities, working with others, managing services, improving services, setting direction for future. How could leadership skill be acquired in clinical practice? This is the way the patient should be in the center. And by doing clinical audit, clinical care pathway, clinical incident analysis, managing clinical risk, patient safety programs will help us to acquire these competencies. And often it is small thing that makes a big difference, and often it is smaller skill that achieves the big thing. We should start somewhere. छोटी छोटी चीज़ें आप acquire करने की कोशिश करेंगे तो आप बड़ी चीज़ों की तरफ जाएंगे. And these are the 3 persons: Adib Rizvi, Hakim Saeed, and Dr. Ayub Umayya. And I put Dr. Nasir Hamdani here. He always work a lot for the patients, for Gaza people, for Kashmir people, I have always seen him. He is a future leader, and I expect everyone is a future leader. You have to play your role as a medical leader. Medical leadership has become vital for the provision of high-quality healthcare. Leadership development should be an essential component of medical education at all levels, especially with Islamic contextualization. The concept of mentoring, relationship, strong professional network, and experiential learning are excellent way of future medical leaders. Every one of you sitting in the hall is a leader or a potential leader. Learning administrative leadership along with clinical leadership can altogether change the scenario. And this is the behold, you are all leader, and you will be asked about those you will lead. Imams are the leader of people, and they will be questioned. A man will be asked about the household as a leader of the family, and a woman is the leader of her children and will be asked. A medical profession as a leader should know three talks: when to lead, when to be led, and when to facilitate. Know to switch from one role to another during execution of complex work. Ultimate mission of doctor is to take care of patient. No matter what the leadership crisis might be, the doctor should continue to treat the patient as his first priority. And I will end my सबक पढ़ सदाकत का, अदालत का, शुजात का, लिया जाएगा तुझसे काम दुनिया की अमामत का. Thank you.